When most people think of 3D printing, they think of space teleportation or replicating dinosaurs or teleporting dinosaurs through space, which I have no idea if that's even a thing. Guys, I'm not a scientist, obviously. But Dr. Beth Ripley looked at 3D printing and she saw so much more.
3D printing is a manufacturing technology that allows you to create graspable, real-world objects from digital two-dimensional data. For example, you could take something like a CT scan of your heart and turn that into a 3D printed object, an exact replica of that patient's heart that you could hold in your hands.
Imagine being able to talk to someone while you're holding an exact model of their heart in your actual hands, like some kind of wild Tekken character. This is not just a power move. This is a new way of planning delicate surgeries without having to take all the parts out of your patient first.
So this idea started a while back, in 2017, actually.
The first model she printed was actually printed on a garage 3D printer, and she actually colored it with her children's markers. And it just sort of went from there. The models became more advanced, and it's been a great asset to have those. It helps with surgical planning, it helps with patient education. When you show them a color model, it gives them a much better understanding of what we're going to do. We can refer to it during the operation. It's easier to look at than it is to pull up the CAT scan or the MRI.
What Dr. Ripley saw was an opportunity to use technology not only to help veterans, but also to help those doctors and nurses who are operating on veterans treat their patients more efficiently and treat them in a way that actually cuts down on the potential for mistake. That's the kind of leadership style that we at VA take pride in.
Dr. Ripley's pioneering work in 3D printing has been able to help in a wide variety of ways, from helping patients understand what's happening inside of their bodies to designing prosthetics perfectly fit to their needs. Having 3D printed models can make surgeries faster and more cost-effective, or allow doctors and patients to decide ahead of time whether or not to even have surgery in the first place.
So we had a veteran who lived in a very remote area within Alaska, so a rural veteran. And so it's difficult to come into the hospital. And he had a really difficult and complex hip injury. And we really wanted to minimize the number of times this veteran had to fly back and forth. So we ended up getting a CT scan up in Alaska. We printed out his hip, the actual hip and the actual size. Then the surgeons were able to really look at the case, and they realized that this would be a very difficult and dangerous surgery and potentially would not have a good outcome. And based on that, they were able to decide that physical therapy and other treatment options were much better for this patient. Our patients at the VA have seen so much and gone through so much that we really want to be able to give back to them. It can be making an assistive technology device that allows an amputee to fish again. It can be making a special customized splint for a hand that allows a veteran to pick up his 2-year-old daughter. The VA is really quite an innovative place.
When COVID-19 hit, Dr. Ripley and her team pivoted to using their network of 3D printers for production of personal protective equipment, or PPE.
The pandemic has changed a lot for us. We were asked early on, can you make things like a 3D printed mask or a face shield? To which the first answer was, no, I don't think so. How would I make a paper mask with a 3D printer? But once you get over that and you think, no, wait, my job is to make the impossible possible. And we actually created a 3D printed mask in 10 days. But that was really just the beginning. So since then, we thought about ventilator parts. We're actively involved right now in 3D printing nasal swabs and figuring out the safety and efficacy of them. We're trying to think of new ways to do personal protective equipment for patients. We have over 200 printers in the system, hundreds of staff that are learning this new technology and innovating, dozens of designs specifically made to address the risks of supply chain vulnerability.
The skills Dr. Ripley brings to her job could have been used to do anything, even print dinosaurs in space, which would be so incredible. But the point is that Dr. Ripley could have used her skills for anything, but she chose to apply them to public service because she is even more amazing than dinosaurs in space.
I'm not surprised she was nominated for this. She's the epitome of public service. She's talented, she's motivated, she's innovative, and she's dedicated a lot of energy to the 3D project.
Technology and VA go together. We developed the first nicotine patch. We developed the first liver transplant. We developed the first cardiac ablation procedures. 3D printing is the cutting edge for the future. And Dr. Ripley's work is advancing the cause of veterans' health care and also offering to her fellow employees the opportunity to move forward in that kind of work. And she exemplifies what we're all proud of here at VA.
For all of these reasons, I am very proud to honor Dr. Beth Ripley with this year's Science and Environment Medal.
When I heard I won, I thought it was a joke. I thought there's no way. The people in the category with me are amazing. And so I felt very surprised. And I think it can be hard to receive praise for something that's much bigger than yourself. This isn't really about me. This is about the entire VA family, the 3D printing community that came together and built this. But I'm really excited though and really thankful for the opportunity to be able to elevate this work and tell the story of what we're doing. Public service is really a gift. When you don't want to get out of bed in the morning and you're having a hard day, to think, no, you know what? Somebody needs me and there's something that I need to do. And by being part of the public service, we can do big, important, messy things that would be so hard to do on our own.